Liberals' favorite billionaire hero, Bill Gates, is lying to you in a way that is profoundly harmful for lives in the global south and for your health right here in the U.S. Let me explain. So as you know, while the U.S. is doing pretty well in vaccine administration, with half of U.S. adults having received at least one dose, poor countries are in truly desperate shape. Somewhere around 3/4 of vaccine doses have been administered in just 10 high-income countries. Over 100 countries have yet to administer their very first dose. India, of course, has become the new ground zero for exploding COVID cases. The U.S. just recently lifted an embargo on the raw materials needed to help make COVID vaccines in that country and to improve their vaccination rates. But in general, it's a mess. And it's a mess for basically one simple reason: greed. Pharma wants to keep their profits high, and they have aggressively lobbied their home countries in the U.S. and in the EU to make sure that they can achieve that goal, protecting their patent monopolies so that generic versions of their life-saving vaccines cannot be manufactured, which would both increase supply and lower the cost. They have had an extraordinarily powerful ally in that fight to protect their bottom line: human lives be damned. Our own supposed savior of global public health, Bill Gates.
Is there a such thing? Oh, I can't ask chat this. Never mind. I have to Google. Can second-generation vaccines become as low cost as generic medicine? Okay, so this is my question that I was going to ask chat, but I don't know why I would ask chat this. Is there such thing as a generic vaccine? But it doesn't really seem like vaccine manufacturing is done necessarily the same way.
Now, Gates has been pushing a solution to poor nation vaccine distribution that conveniently protects pharma profits. That is the COVAX program through the World Health Organization, where rich countries donate to secure doses for middle-income and low-income nations. Sounds good maybe in theory, but in practice, it's been a joke. They set a goal of 2 billion doses, which would still, by the way, be insufficient to meet the need, but they've instead provided a pathetic 38 million doses. Has this dramatic underperformance led Bill Gates to rethink his approach? Because let's not kid ourselves, by dint of his money and his connection, he has essentially appointed himself the unofficial world czar of public health. The answer of whether he's rethought it is, of course, not a chance. In an interview on Sky News, Bill Gates was asked whether it would be helpful to lift vaccine patent protections in order to increase access. Here is his answer.
There's been some speculation that the changing intellectual property rules and allowing these vaccines, as you say, the recipe for these vaccines to be shared would be helpful. Do you think that would be helpful?
No.
Why not?
Well, there's only so many vaccine factories in the world, and people are very serious about the safety of vaccines. And so moving something that had never been done, moving a vaccine from, say, a J&J factory into a factory in India, that it's novel. It's only because of our grants and our expertise that can happen at all. The thing that's holding things back in this case is not intellectual property. There's not like some idle vaccine factory with regulatory approval that makes magically safe vaccines. You've got to do the trials on these things, and every manufacturing process has to be looked at in a very careful way. There's all sorts of issues around intellectual property having to do with medicines, but not in terms of how quickly we've been able to ramp up the volume here. I remember how shocked people were when we said we were going to do second sources in these developing country factories. That was a novel thing. We got all the rights from the vaccine companies. They didn't hold it back. They were participating. I do a regular phone call with the pharmaceutical CEOs to make sure that work is going at full speed.
Bill Gates is claiming that the manufacturing of vaccines, that it's not an arbitrary process to create once you have a formula to create a vaccine. What Bill Gates is saying is that there is some sort of technological know-how, or there is some sort of manufacturing process that is unique to these companies that have developed these vaccines, and that makes it hard to just release a patent and have them made. It doesn't work that way. Now, if she's going to counter this argument, then she needs to address that point. She needs to show us, well, actually, that's not true. So here is evidence of certain vaccine manufacturers that aren't able to manufacture anything in these countries. They've manufactured vaccines of similar complexity in the past. Bill Gates is just not correct here. If they had access to the patent, that's all they would need, and then we would see them begin to manufacture these vaccines. That's how she would counter this. Let's see what we get.
Work is going at full speed.
So let's just unpack what he says there. His argument is that lifting patent protections will not help the supply problem whatsoever. So it's better to just stay the course and produce at the current level and hope that eventually rich countries donate enough money and surplus vaccines that poor countries get taken care of. In his words, it's not like there's some idle vaccine factory with regulatory approval that makes magically safe vaccines. Oh, really? I present to you this article from the AP. In an industrial neighborhood on the outskirts of Bangladesh lies a factory with gleaming new equipment imported from Germany. Its immaculate hallways lined with hermetically sealed rooms. It's operating at just a quarter of its capacity. It is one of 3 factories that the AP found on 3 continents whose owners say they could start producing hundreds of millions of COVID-19 vaccines on short notice if only they had the blueprints and the technical know-how.
That's good. Let's check the article to see if it's true. Well, actually, she's sourcing the AP, so I imagine it would be true. I don't know what the counter argument then would be to that. Does Bill Gates, would he just say that these factories are lying, or?
I present also to you.
Wait, hold on. If only they had the blueprints and technical know-how. I wonder what that last part means, but.
Vaccines on short notice if only they had the blueprints and the technical know-how. I present also to you, John Fulton.
You could argue that technical know-how, though, that might be contained in, that could be contained in the patent itself. So maybe the technical know-how would be understood if they had that patent. We should read the whole thing. The industrial neighborhood in the outskirts of Bangladesh's largest city lies a factory with gleaming new equipment imported from Germany. Hold on. Bangladesh, over here. Okay, east side, India. Oh, we kind of know because Myanmar is over here, right? They had that one stream with the yoga girl, and then in the background, There were the tanks rolling around. Pharmaceutical companies that took taxpayer money from the US or Europe to develop inoculations at unprecedented speeds say they are negotiating contracts and exclusive licensing deals with producers on a case-by-case basis because they need to protect their intellectual property. Wait, hold on. So, at least for Pfizer, I thought that in terms of taking taxpayer money, I thought that it was just a purchase agreement guarantee. I didn't think that the actual research itself was subsidized by the U.S. government. Does anybody know that? My understanding was the way that the Operation Warp Speed stuff worked was it was basically a contract to guarantee, at least for the Pfizer one. Maybe Moderna or Johnson & Johnson, maybe those were subsidized by the U.S. government.
On the north, east and west side by India. PP wins.
One of the things that would be really worrisome, I don't know if you know this, there's an IP component of the WTO called TRIPS. This allows any country to issue a compulsory license for a drug for essentially any reason as long as they compensate the company at the end, and this compensation is generally very low in practice. So any country can license any drug they want for any reasons without regard for patents. So I'm somewhat familiar with TRIPS. I think, did Bush push for that? I remember coming across this when it came to do research for the multilateral trade agreement shit. But I'm pretty sure that the way that it works is supposedly any poor country, if they want to be able to manufacture a drug, and they can show like, dude, if you give us this like malaria drug, we can cure like 100 billion fucking people. That as long as you do that, as long as you can show that need, then they're able to like apply for it and just manufacture like a generic like almost instantly off of it with like very, very low compensation of the anti-something. The biggest worry I would have with getting like vaccines made at these facilities that aren't necessarily or haven't been equipped in the past to do it is if there are any fuck ups at all, that's gonna like damage like worldwide views of vaccines. Like we already had like the 6 blood clots and like people are already like, oh shit, like I don't know, blah blah blah. Like that's a legitimate concern as well. Although these guys say they can do it, but yeah, I don't know. It's already happened in the EU with the fuck-ups of the vaccine rollout, and already anti-vaxxers in the EU are showing up like shrimps. Jeez.
Short notice, if only they had the blueprints and the technical know-how. I present also to you John Fulton, president of BioLease in Canada, who says he could be making millions of doses today if the know-how had been shared. We've been passed over. We've got this production capacity and it's not being put to use. If we had started this last year, we could have shipped millions of doses by now. This is supposed to be like a wartime effort, everyone in it together, but that does not seem to be the case. And finally, I present to you the words of Manuel Martin, a policy advisor to Doctors Without Borders. The Gates organization dampened early enthusiasm by saying that IP is not an access barrier in vaccines. That's just demonstratively false. Demonstratively false. Bill Gates is lying to you when he says that lifting patent protections will not help with access. Now look, it may not magically fix everything, nothing is a cure-all, but it is a root cause of the problem, and it would help to ease the supply issue so that poor countries can start vaccinating and we can all avoid.
What is this?
And so obviously it seems to the people on Twitter that
This is from February 4th.
But I wanted to know from Bill, what was the real story?
Well, the making a safe vaccine is more complicated than, say, making a jet engine. And people are very picky about vaccines. In fact, you could ruin the reputation of vaccines if you're making them in factories where the quality control at every stage is not exquisite. And, any mistake, you can have that factory shut down literally for months at a time when its output is needed to save millions of lives. So vaccine factories are not something that you just, like open source code that you can take and, mess around with. And so the limitations on how many vaccines are being made, that's based on how many great, capable vaccine manufacturers there are in the world. And we've made sure that the AstraZeneca is being made in these big Indian factories, and there's no royalty for that, no charge at all. Now, we've had to fund that, the Gates Foundation. These are companies we've been working on their factory quality for over a decade so that there was spare capacity to make inexpensive vaccines. So Oxford University is wonderful, but they're not capable of doing a phase 3 trial, and they don't have factories. We did tell Oxford that they needed to seek somebody with expertise, and AstraZeneca came in, and we didn't control that agreement, but they came in and said, hey, they want to do it on a nonprofit basis. And I'm impressed with how they put their best people on it and helped out. The pharma companies who didn't get involved,
nobody's criticizing them. So, you feel sorry for the ones that are really miraculously helping make these vaccines.
These are the very good reasons that I suspect exist, but that's where I feel like social media.
It would be interesting to hear like somebody more qualified or somebody that's equally qualified in this, I guess, go back and forth on him here. Because I mean, like he said there are some factories in India producing this vaccine. I don't believe that there's only like a few countries in the world capable of producing vaccines, right? Like I'm sure like any major country should have the production capabilities, but maybe like specific factories are needed for more specific, like maybe for this mRNA vaccine, maybe it's a more particular type of like synthesis that goes through or something like.
Media just doesn't get the nuance, and it pains me to see the world like that.
What a fucking liar, dude. What a fucking weaselly little liar, dude. What a fucking liar, dude.
And even to see you, Bill, be the target of some of these conspiracy theories, it seems to not bother you, but it kind of bothers me as a guy who wants everyone to live in the same kind of reality, and I see out there doing great things, and I think that that should be commended as opposed to
I might be dumb, but isn't this similar to how fabs and foundries for semiconductors are almost only in Taiwan and maybe in the US? Yeah, I don't even. Do we have fabrication plants in the US for semiconductors? I thought almost all of that shit happened in like Taiwan, is it Taiwan in another country? Intel does, very, very small though. Because those are things that are very, 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 I don't know why. I just know they are very hard to manufacture semiconductors, and that you can have like whole batches of chips that get fucked. And even the process itself is not like very refined, or rather like, let me see if I can explain this. I don't know if this is the case now because I've been out of the PC building market for so long, but it used to be that like you would take a whole bunch of processors and then you would do the fabrication on a whole bunch of computer dies, and then basically depending on how good they turn out, like this is a really good one, we're gonna call this a K series chip because you can probably overclock it. Like this one's kind of shitty, we're just gonna call this as a normal non-K series. And then like this one is trash. It's gonna be like we're gonna like actually lock off 2 of the cores, and we're just gonna sell this as like a 4-core chip or a 2-core chip because it's not even like completely working. Like that, like basically like this idea of like the imperfections in the manufacturing process will determine like what kind of processor a chip actually becomes.
You get. I'm not in a position to complain much. I have a lot of things that make me extremely lucky. And, I hope these conspiracy theories go away.
This is why some chips that you get will be, this is why some chips that you get will like overclock really, really, really well. And it's why some chips like are duds for overclocking. When I used to build computers for people, I remember like every now and then I'd get that Blue Moon 4790K that could overclock to like 5 gigahertz. And then some of them would like chug at like 4.6. It'd be like really hard to move them. I think I had one that I couldn't push past 4.5. It was like so fucked. And yeah, and people will and it I don't know, again, I don't know if this is still the case, but it used to be like in the really, really hardcore communities. I say hardcore, unlike overclock.net or whatever the fuck. You'd have people that would keep track of like, if you can get like this serial number on the box, then that means that it came from this like batch of chips, and that like it's going to overclock well as long as you can get one. And then companies will also, like GPU manufacturers and shit, will get special chips that they know like performed really well at the fabrication plant that are binned, like the idea of taking one and putting it in a bin for a really good chip. Like they know that these will overclock well or do well. Like, yeah.
I don't know what it'll mean for the future.
How do you feel about the vaccine rollout so far?
Well, we need the supply, we need the logistics, and we need the demand. And there are huge challenges in each of those. I'm hopeful that Johnson & Johnson in the next month will get approved, because that's a single-dose vaccine, very cheap, highly scalable. So AstraZeneca, Johnson & Johnson, and a few months later Novavax, most of the developing world, those are the vaccines that will be going to them. And so we put billions into trying to make that happen, and in a few months, hopefully it'll come together.
Jesus Christ. Sorry.
With the horror of watching the virus mutate to the point where it jumps the current vaccines. Bill Gates, with his billions, set the course for how global vaccine distribution would unfold, and now millions of people around the world are paying the price. Now, for those who've been tracking Gates' actions in the public health space for decades, these new comments will come as absolutely no surprise, as journalist Alexander Zaitchik writes over at TNR. Since Gates got involved in the AIDS epidemic in Africa in the late 90s, he has cultivated close relationships with big pharma execs, lauded their wonderful and noble efforts, and aggressively pushed industry-friendly policies with regards to patents. This significantly set back access to AIDS antiretroviral therapies and
What is so like Bill Gates is already like fucking billionaire. Like what is it? And he's like retired from working at least. He just does his foundation. Is like the implication that he's just going around like trying to fuck over everybody and just make other people wealthy now, like other CEOs? Is that like the implication, or that he's just evil, or?
Has been a disaster for COVID vaccine access. Gates' pro-industry stance also should come as no surprise, given that the man is a billionaire uber capitalist who made his own ill-gotten fortune by novel exploitations of patent law and unchecked monopoly power. Now, he may sincerely want to cure disease and make the world a better place. He also has a sincere ideological commitment to protecting monopolies and profit margins for some of the world's worst actors, and that he doesn't seem to care what the consequences are. He and pharma argue that patents help foster innovation, which creates the life-saving drugs that we all benefit from. This, too, is largely a lie. Every new drug developed over the past decade was funded by U.S. taxpayers. The revolutionary mRNA technology that pharma is so worried about monopolizing now was developed by university researchers and scientists at the NIH and the Department of Defense.
Okay, I have to do this because I apparently have to say this like every fucking time. The general research does not give us drugs. General research creates the conditions by which we can actually begin to like create drugs, right? Like that's great that you can discover a process that allows us to create things in new ways, but that doesn't get us anywhere on its own, okay? You need to actually take these things, put them into formulas that have like the necessary like availability to your body that also like don't cause bad side effects. And then you need to trial these on like millions of people, depending on once you scale up to your whole, I don't know how big a phase 3 trial has to be actually. I don't know what the number is, but it's a massive amount of money that's needed, right? The public does not fund that. That's funded by private companies. There's a ton of money that goes into these types of research trials. It's cool that a lot of general research is funded. That's awesome. But general research does not give you a drug, right? That requires like actual pharmaceutical research. It's a different thing.
Now, I know we've got a complicated love-hate relationship with billionaires in this country, but maybe, just maybe, it is not such a great idea to outsource global public health policy to a rapacious monopolist. Maybe, just maybe, it's not such a great idea to outsource labor market conditions and unionization rates to another rapacious monopolist at Amazon. Maybe we shouldn't be outsourcing free speech and censorship to another set of monopolists in Silicon Valley. Perhaps these men are good people. Maybe they're not good people. Maybe they're well-intentioned. Maybe they're not. But no one voted for them to be king of the world. They are totally unaccountable to a single soul. And every one of them is committed to existing power because they are existing power. Sagar, back when we covered that poll about billionaires, liberals love Bill Gates, right? I mean, he has intentionally created this incredible halo around him. And I'm not going to say he hasn't done good in the world.
He's done a lot of good.
This isn't to even judge him personally, although I do a little bit of judging him personally here. But the bigger story here is about why do these individual billionaires have so much power? And these are the type of devastating consequences that can result. Look, this was entirely predictable from the beginning. And if you rewind back to the beginning, there was a lot of talk about a people's vaccine and making sure that we were in a war.
Something that I think is interesting to kind of think about, a lot of people get really upset that in our current system that like capital gives you more representation in the form of a government. Now, I think that people will say, I don't like the idea that having more money means that like you get a bigger voice or whatever. But I think what they mean is they want everybody to have an equal voice. So we criticize the fact that at least in our current system, it seems like if you have a lot of money, you've got a bigger voice, and people don't like that. So they say like, oh, more money should equal more voice. But again, I think that the problem is people want everybody to have like people want everybody to have like a more equal voice. I think that the problem with that though is that it feels like if we stripped away the money aspect, I don't know if you would ever be in a society where everybody has like one say, like one voice, one vote. I feel like you would always be trading around some forms of influence. So if we were to eliminate currency, right, it would come down to the people that like own all the capital, right? Well, who's got the biggest manufacturing buildings, who blah, 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 right? If we got rid of like private ownership of capital, it would be like, well, who's the most influential person that, who's like the best speaker, who has the most friends, who's got the most connections? If we got rid of that, it'd be like, oh, well, who's, situated in this geographic area? Like there'd always be like, I feel like there's always going to be some uneven form of like wielding of influence that is never going to go away. I'm reminded in that book, the Politics is for Power book. One of the guys in that book that had amassed so much political capital was he immigrated from some fucked country, I think as a doctor, maybe? I don't even remember if he was, but he immigrated from some fucked country and he came over to the United States. And part of the way that he got a ton of political capital was, I think when he came over, he started helping a bunch of people do a bunch of shit. Like, he would help them fill out forms for voting. He would help people get like their yards mowed. Like, he was just like the guy that everybody in that community went to. And he became like a really big deal, such that in his local scene, you know, like every local politician, I think even like state representatives, and then I think even like federal representatives would go and like talk to this guy to make sure that they had like his support and shit, because he was so influential in terms of the power that he wielded. So before, because there's some dipshit is making a Reddit post right now about how Destiny doesn't think blah, blah, blah. Like, I'm not saying that any of these things are good or bad. I'm not saying it's good that capital or money gives you big voice in politics versus not having much. I'm not saying it's bad that blah, blah, blah. I'm just things to think about, okay? These are just thoughts. They're thoughts about thoughts, okay? Would you say it's easier to be like a better speaker than it is to become really wealthy? I don't know, actually. I'm not entirely sure. I don't know what would be easier there. I really don't know the answer to that, right? Like, technically in the United States, there is a path for most people to become like decently wealthy. If we say wealthy as like you earn like into your career, you'll be earning like a 6-figure income. Like, I think there's a path for that for most people in the United States. If you're willing to go to college, get like an engineering degree or something. Could most people become like really powerfully influential, good public speakers? I don't know. I feel like that skill might be a bit more unique or a bit harder to find.
Wartime effort to get vaccine supplies when they're developed, not just to the rich world, but around the globe, because that risk is real for absolutely everyone, even if you don't care what's happening in India or other places around the world. Bill Gates really set the course here, saying, no, we're going to go with this COVAX program through the World Health Organization. It protects pharma profits. Rich countries are going to donate. That thing has been a total joke and a total disaster, dramatically underperforming their targets, which were already inadequate. Clearly, if we would lift the patent protections, no, it wouldn't be a cure-all. But when he says it wouldn't do anything, that it has nothing to do with supply, I mean, that is just such a provably false absurdity.
No, it's true. And it's because the Gates people, the Gates Foundation and more, are deeply tied in with the pharma industry. And you know what really puzzles me about this is if he's true to his word, then lifting patent protection on mRNA would be probably one of the greatest gifts to curing malaria that's happened. I was just talking about this the other day. There's a new mRNA malaria vaccine. People may
What does he mean, lifting patents on mRNA? That research is publicly available, is my understanding, right? Like the process, maybe not for a particular vaccine, but
know this. Vaccinating against malaria is very difficult. It's actually not particularly effective. One of the largest killers, along with HIV, in the third world. That's what he dedicated his life to. And yet, you know, he got here. And like you said, look, Bill Gates personally has literally saved millions of people. So, like, I don't want to say that that's not the case. But it is a broader question. There's a new controversy. I don't know if you guys know about this, where Gates is funding research in order to literally dull the sun, in order to try and affect greenhouse gas emissions. Now, maybe that's a good idea. It's called controversial technology called solar geoengineering. This is all in Popular Mechanics. You can go look it up. I'm not a conspiracy
theorist. It's not some weird Gates conspiracy.
Here's the problem. Who decides? That sounds like something we should maybe all have a consensus around, the World Health Organization or the WTO or something, the UN, and like everybody signs on instead of somebody creating this technology, trying to deploy it if they want to. I mean, do we even have, like, if somebody wanted to, like, you can launch whatever the hell you want up into space. Like, seriously. I mean, there's not really a lot of governing bodies around this stuff, and pretty much any government, you know, in the third world or whatever lets you do anything.
I thought the space shit was like really carefully regulated. Is that not true? Even our airspace, I thought, is like pretty carefully regulated. Can anybody just launch anything they want? Don't we literally track like every single piece of thing that, like, anything that's space debris and all that shit? Like, I'm asking questions, but I'm actually, this is true. There might even be, I don't know if there's public websites or if it's only available to like defense people, but like there are websites where you can go to and you can see every single piece of debris that's floating in our atmosphere and like around our, at least like low Earth orbit stuff like right now. Like, I'm pretty sure all of that is very, very, very carefully tracked, but
you want for $60 million. So is that something you want to allow? And this is about power, which is that it's like, do you want the ability of a single person in order to literally dull the sun? I'm exaggerating, but I'm also not, because it's actually possible.
Like, I mean, it sounds like the plot of like a bad Austin Powers movie,
except
where like
it's
the
true,
villain is like going to single-handedly dim the sun for the entire planet, and yet that is what is happening. And again, look, I want to be clear here. There's a lot of stupid, crazy Bill Gates conspiracy theories out there.
Nothing about 5G
we have nothing to do with that, right? And he's not like implanting chips in you with the vaccine, or I don't even know what the conspiracy conspiracies are. This is the factual information reported out and his own comments about what he thinks about patent protection. So yeah, on the one hand, I'm sure he has saved a lot of lives.
Yes.
On the other hand, right now, his actions are risking millions of lives, because the fact that they had this patent protection in place from the very beginning means all of those factories and more around the globe that could have spun up to produce hundreds of millions, if not more, doses of vaccine are totally unable to operate. And he, maybe more than anyone else, is the architect of the direction of the vaccine distribution. And look, we also got to say, the Trump administration policy was the same as now the Biden administration policy. They are blocking an effort at the World Trade Organization to temporarily lift these patent protections. And I just have to always say that what they will argue is, oh, we need the patent protection so we can do research and development. That's why we have it. They didn't develop this technology. mRNA was developed by US government public taxpayer funds. Every single new pharmaceutical in the last 10 years was developed by public funding.
That statement is just a lie. That's not true. Pharmaceutical drugs are not made by public funding, okay? General research is, and there are pharmaceutical companies that build on that research to create therapies or to create drugs, but those drugs are not created by public funding. That's not how that works.
So don't believe their propaganda and their lies. They, by and large, are not the ones doing the life-saving research here. The public is creating the good, and the...
If that's true, then why don't we just have a public vaccine made? Just think about that. Why didn't we just make a public vaccine then? When you say create, do you just mean manufacture? No, okay, where's the PhD guy? Okay, this is my understanding of how things work, okay? Yeah, you know what? I'll draw it all out. I might be totally fucking wrong, okay? Fuck me, okay? Maybe I'm totally wrong, okay? This is kind of my understanding of how things work, okay? So we have here some general body of shit, okay? All right. Oh, cool. We know some biology. We know some chemistry. We know some physics. Maybe even a little bit of math. Maybe a little bit of music. Oh, cool. Okay. So what'll happen is maybe we'll make breakthroughs on research. Oh, cool. We're doing a lot of organic chem work because there are people that take that major for some reason. Oh, we're figuring out this information. Oh, cool. We developed this mRNA stuff. This is awesome. Now, all of this research here, all of this research is public. This is all publicly funded through grants, through the government, through universities and tenured professors and all these people that do research. All of this is publicly funded, okay? So what'll happen is oh my God, breakthrough. Wow, breakthrough. We've got an mRNA process by which we can put together vaccines. This is so cool. Cool, awesome. And we've all done this and we've all publicly funded it, okay? Okay. That's it. Nobody is helped. Nobody is saved. That's it. You have nothing, okay? What happens next is a really important part, okay? Now what happens is somebody says, hey, we've got a new process by which we can we can manufacture, we can potentially manufacture vaccines. Now, what happens is some guy comes in, okay, and he's like, oh, well, I'm a private owner. I have factories that produce vaccines. This research here is actually really interesting, okay? I am going to try to take this research and build off of it, and I'm going to see if I can, make something out of it. So they'll take this research, okay, and they will try to build off of it. And most of these builds are failures, okay? Oh, fuck. This drug, we tried it, phase 1 trials died. Fuck me, okay? Oh, we tried this one, got to phase 2, died. Oh, we tried this one, phase 3B trials, and it fucking died. $500 million down the fucking drain. Fuck, we got fucked, okay? And then one of these things right here will make it out, passes the trial, gets into manufacturing, and then a big windfall of cash is collected because you're the one that discovered the vaccine that worked. These pathways of private funding is how general research gets taken and then turned into a drug that can be manufactured and distributed to people that actually work as therapies or treatments for their diseases. The general research does not produce, what is this noise? Does not produce the vaccine. It's a private company coming in or some other entity coming in and building off that knowledge to create a drug that actually starts to get tested and trialed that actually creates the therapies. Do they have to pay for the public research in the form of grants or anything, or is it public through? My understanding is that that research is all just public. It's it all just gets published in published journals and shit. It's just public. That's my understanding of it. There might be some stuff that's like secret research that's publicly funded, maybe for like defense or everything, but yeah. Don't universities make lots of money off of research though? My guess for how, again, and I don't know, I could be wrong. My guess is like universities don't make money off the research. They make money when the university gets chosen to do the research. So you might you might request a grant, and the grant has some allocation of money for the people working on it, and then some allocation of that grant is going to be, or some amount of money is going to be allocated to the university. So they get paid like kind of to do the research, but they don't like sell the research. I don't think. Somebody could be wrong, but like I don't think that I don't think a university like sells the research and makes money. I think that the research becomes public. But they get paid like to do the research, if that makes sense. That's my understanding of it. You're right, unless the research PI applies to patent. Okay. The university takes like 50% off the top from incoming grants, but they also own the licenses on products coming directly from research at the institution. Sometimes the PhD advisor will let you patent your research and you both make money. I imagine, though, there'd have to be some special process for that. Otherwise, every single university would just patent all of their research, right? It depends. Yeah, I would imagine it would depend on the type of grant you get, for sure. That's going to be probably baked into the provisions of the grant. In the last few days, the question of why more drug companies haven't been enlisted for vaccine production has come up. It's mostly due to this tweet. The vaccine shortage doesn't need to exist. Pfizer and Moderna could share their design with the dozens of other pharma companies who stand ready to produce their vaccines and end the pandemic. This article is by Derek Lowe. Derek Lowe is commenting on drug discovery and the pharma industry, an editorially independent blog from the publishers of Science, Translational Medicine. All content is Derek's own. He does not in any way speak for his employer. Why do people even add this anymore? It doesn't do anything. Derek Lowe got his BA from Hendrix College and his PhD in organic chemistry from Duke before spending time in Germany on a Humboldt fellowship on his postdoc. He's worked for several major pharmaceutical companies. Okay, dude. Okay, nice appeal to authority, bro. Loser. All right. The problem is, as far as I can see, this is simply wrong. There are not dozens of other pharma companies who stand ready to produce these mRNA vaccines. To me, this betrays a lack of knowledge about what these vaccines are and how they're produced. Even though I'm not a pharma manufacturing person, I am indeed a pharma researcher in general, so I'd be glad to fill in this gap, and here's why it's not possible to suddenly unleash dozens of companies to crank out the Pfizer, BioNTech, and Moderna vaccines. These days dropping this other kind of epic. Nice name, student. The first thing to understand is that these are not, of course, traditional vaccines. That's why they came on so quickly. mRNA as a vaccine technology has been worked on for some 20 to 25 years now, from what I can see, and, as I never tire of mentioning, we're very fortunate that it had worked out, and quite recently, several of its outstanding problems just before the pandemic hit. 5 years ago, we simply could not have gone from sequence to vaccine instead of a year. And I mean that we, to mean both we, the biopharma industry, and we, the human race. At this point, let me briefly dispose of an even less well-founded take that's been going around as well. I've seen a number of people say something like, we had the vaccine back in February. It only took till the end of the year to roll it out because of the FDA. The main thing I'll say about that idea is that no one who actually works in vaccines in any capacity has any time for that statement. Not all vaccine ideas work. We're already seeing that with the current coronavirus, and if you'd like to talk to some of the folks about that, then I suggest you call up GlaxoSmithKline and Sanofi and ask them what happened to their initial candidate. And while you're at it, call up Merck and ask them what happened to their two. Note that I've just named 3 of the largest, most experienced drug companies on the planet, all of whom have come up short. So no, we did not have a vaccine in February. One of the other reasons we didn't have it back then is the whole problem of figuring out how to make this stuff. And that brings us back to today's discussion. How do you make the Moderna and Pfizer/BioNTech vaccines? And what's stopping dozens of other pharma companies from doing the same? And what's stopping dozens of other pharma companies from doing the same? Let's get into those details, stopping briefly again to imagine asking James Hamblin above to actually start naming dozens of pharma companies. Anyone have a good over or under on how many names would get rattled off? Okay, let's look at the actual supply chains. The single most informative piece I have seen on this is from Jonas Newbert. I've recommended it before, and this is absolutely the time to recommend it again. I also have to mention this detailed article at the Washington Post, which focuses on the Pfizer-BioNTech vaccine, and this one at KHN about manufacturing bottlenecks in general. You should also read this Twitter thread from Rajiv Venkaya, who knows what he's talking about when it comes to vaccine manufacturing too. All of these will cover details that I'm not even going to get to today. Exploring the supply chain of the Pfizer/BioNTech Moderna COVID-19 vaccines. Holy Jesus. What a fucking nerd. It's not in my nature, since I'm an early-stage drug research person myself, but I'm going to totally sidestep all the R&D questions behind the various components and just treat this as a manufacturing process that fell from the sky in its final form. To distill a huge amount of background and detail down into the simplified steps, we have... What is this webpage? Step 1, produce the appropriate stretch of DNA containing the sequence that you need to have transcribed into mRNA. This is generally done in a bacterial culture. Step 2, produce the mRNA from your DNA template using enzymes in a bioreactor. Step 3, produce the lipids. Produce the lipids that you need for the formulation. Some of these are pretty common, such as cholesterol, but the key ones are very not much. More of this below, are very much not. Step 4, take your mRNA and your lipids and combine those into lipid nanoparticles. I've just breezed past the single biggest technological hurdle in the whole process, and below you will learn why it's such a beast. Step 5, combine those LNPs with the other components of the formulation, phosphate buffers, saline, sucrose, and such, and fill those into vials. Step 6, get those vials into trays, into packages, into boxes, into crates, and out the door into trucks and airplanes. Okay, you've now produced the mRNA coronavirus vaccines and ship them out onto the world, so sit back and open a cold one. You will not reach that stage, though, without some significant challenges. Let's take those step by step. The DNA production is step 1. It's not too bad. As the Newbert article details, Pfizer does this themselves in St. Louis, and Moderna outsources this to the large and capable Swiss firm Lonza. Update, a good part of the Lonza work is being done in Portsmouth, New Hampshire. DNA plasmid production on an industrial scale is pretty well worked out. And keep in mind that industrial scale for DNA means a few grams. It's not something you can do in your garage. As with every step in this process, there's a lot of purification and quality control to make sure that you're making exactly what you think you're making and that it looks exactly within the same specs as the last time you made it. But that's what biopharma manufacturing folks are good at, and there are a lot of people who can do that. That said, a goodly number of them are occupied doing that for just the vaccines, but if we needed more of this DNA, sure, we could produce more. But we don't. That's not the rate-limiting step, nor is step 2, the transcription into mRNA. Pfizer and BioNTech do this in Andover, Massachusetts, and at biotech facilities in Germany. They have manufacturing in Eider Oberstein, a town I recall visiting in the cold rain one weekend in 1988 during my postdoc. And last fall, they bought another facility in Marburg, which is just getting revved up for such production now. The Moderna mRNA step is handled in Switzerland by Lonza. Now, this is not so common as an industrial process for sure, because it's only relatively recently that people have been treating RNA species as actual drug substances themselves worthy of scale-up manufacturing. If I had to ask someone else to make me some more bags of bespoke mRNA, I might turn to Alnylam, who have a manufacturing facility in Norton, Massachusetts, although to be sure, they're using it for their own drugs. But doing so would not increase the number of vaccine vials coming out the other end of the process. RNA production is certainly closer to being rate limiting than step 1, but it's nothing compared to the real bottlenecks that are coming. Now to the lipids in step 3. This doesn't have to be done in sequence like the DNA and RNA step, of course. The lipids needed for the formulation are an entirely different production process. As the Newbert article will show you, Pfizer and BioNTech are getting all of theirs from a UK company called Croda, with production likely going on in the town of Alabaster, Alabama, which, unlike Eider Oberstein, I am certain that I have not visited. Now, each of these vaccines needs some odd lipids with positively charged groups on them. That's a crucial part of the formulation. These are surely not trivial to make on scale, but they're still small molecules with relatively straightforward structures. I'm sure that barrels of these things aren't stacking up at the factory for lack of demand, but I don't believe that they're the limiting reagent in manufacturing either. If you had to, you could surely get some other manufacturers up to speed on the process. I'm going to skip ahead to step 5 and step 6. These are surely running at a good clip, but they are more traditional functions of a drug company or of any manufacturing company. It's true that pharmaceutical vial, fill, and finish on this scale narrows you down to few players that would be involved in, say, canning tuna. Narrows you down to fewer players than be involved in, say, canning tuna. But these folks are already involved. Pfizer is doing this in Kalamazoo and in Purs, Belgium, and BioNTech is doing this at several locations in Germany and Switzerland, both at their own facilities and via at least 2 contracting firms. Moderna, meanwhile, outsources this to some of the big players in the US and Europe, Catalent, Rovi, and Recipharm. Everyone in this part of the manufacturing business has known for months that a big vaccine push has been coming and has been cranking up vial manufacturing, bringing all available production lines up to speed and signing deals all over the place with everyone who has any kind of advanced vaccine effort. But now we get back to step 4. As Newbert says, welcome to the bottleneck. Turning a mixture of mRNA and a set of lipids into a well-defined mix of solid nanoparticles with consistent mRNA encapsulation, well, that's the hard part. Moderna appears to be doing this step in-house, although details are scarce, and Pfizer Biotech seem to be doing this in Kalamazoo, Missouri, and probably in Europe as well. Everyone is almost certainly having to use some sort of specially built microfluidics device to get this to happen. I would be extremely surprised to find that it would be feasible without such technology. Microfluids, a hot area of research for some years now, involves liquid flow through very small channels, allowing for precise mixing and timing on a very small scale. Liquids behave quite differently on that scale than they do when you pour them out of drums or pump them into reactors, which is what we're using in more traditional drug manufacturing. That's the whole idea. My own guess as to what such a vaccine machine involves is a large number of very small reaction chambers running in parallel that have equally small and very precisely controlled flows of the mRNA and the various lipid components heading into them. You will have to control the flow rates, the concentrations, the temperatures, and who knows what else. And you can be sure that the channel sizes and the size and shape of the mixing chambers are critical as well. There will be special purpose bespoke machines, and if you ask other drug companies if they have one sitting around, the answer will be, of course not. There's not anything close to a traditional drug manufacturing process, and this is the single biggest reason why you cannot simply call up those dozens of other companies and ask them to shift their existing production over to making the mRNA vaccines. There are not dozens of companies who make DNA templates on that needed scale. There are definitely not dozens of companies who can make enough RNA. But most importantly, I believe that you can count on one hand the number of facilities who can make the critical lipid nanoparticles. It doesn't mean that you can't build more of the machines, but I would assume that Pfizer, Biotech, Moderna, and CureVac as well have largely taken up the production capacity for that sort of expansion as well. And let's not forget, the rest of the drug industry is already mobilizing. Sanofi, one of the big vaccine players already, and one with their own interest in mRNA, has already announced that they're going to help out Pfizer and Biotech. But look at the timelines. Here's one of the largest, most well-prepared companies that could join in on a vaccine production effort, and they won't have an impact until August. It's not clear what stages Sanofi will be involved in, but bottling and packaging are definitely involved. There are no details about whether LNP production is, and Novartis has announced a contract to use one of its Swiss locations for fill and finish as well, with production by mid-year. Bayer is pitching in with CureVac's candidate. This is all good news, but it's a long way from the tweet that started this whole post off. There are not dozens of companies who stand ready to produce vaccines and end this pandemic. It's the same few big players you've already heard of, and they're not sitting around and watching either. To claim otherwise is a fantasy, and we're better off with the facts. Wow, now that's what I call a cool story, bro. For the record, that video makes some stuff up. Bill Gates was involved in setting up an exclusive deal with the Oxford vaccine, which is an adeno-based vaccine. Cool story, bro.
Remember to hit that like and subscribe, and don't forget the notification bell so that my videos show up right in your feed.
Now, Hassan Abi. Oh, actually, I am interested in Hassan.